Food and health. Asparagus. Based on taste alone, asparagus is a favorite food for many. But you'll really love that it's a non-starchy vegetable with only 5 grams of carb, 20 calories. Apples. An apple a day keeps the doctor away, specifically the cardiologist. A 2012 study at Ohio State University published in the Journal of Functional Foods found that eating just 1 apple a day for 4 weeks lowered LDL bad cholesterol by 40%. The professor leading the study explained that not all antioxidants are created equal, and that a particular type of antioxidant in apples had a profound effect on lowering LDLs, a contributor to heart disease. The study was funded in part by a grant from the U.S. Apple Association, among other supporters. This crunchy fruit also appears to offer protection against diabetes. The Harvard School of Public Health examined the diets of 200,000 people and found that those who reported eating 5 or more apples a week had a 23% lower risk of developing type 2 diabetes, compared with subjects who did not eat any apples. More good news. A medium-sized apple contains 3 grams of fiber, which includes both soluble and insoluble fiber. How about them apples? Do remember, however, that 1 small apple has about 15 grams of carb. Some of the large apples in the grocery store are equivalent to 2 servings of fruit. Asparagus. Based on taste alone, asparagus is a favorite food for many. But you'll really love that it's a non-starchy vegetable with only 5 grams of carb, 20 calories, and almost 2 grams of dietary fiber per serving. It's especially high in an antioxidant called glutathione, which plays a key role in easing the effects of aging and many diseases, including diabetes, heart disease, and cancer. One example is the preliminary research reported in 2012 in the British Journal of Nutrition, which suggests that asparagus can help keep blood sugar levels in check and increase insulin production. Another plus for asparagus is its folate content. A 1/2 cup serving, or about 6 1/2-inch spears, provides 33% of the 400 micrograms of folate recommended daily. The American Heart Association advises eating foods containing folate and other B vitamins to help lower homocysteine levels, a risk factor for coronary heart disease. Avocados. Avocados are known for their heart-healthy monounsaturated fat content. When substituting these fats for saturated fat, they can improve cholesterol levels, decreasing your risk of heart disease. According to the Academy of Nutrition and Dietetics, there is even a positive connection between avocados and diabetes. The American Journal of Clinical Nutrition published a study in 2008 that found that women who reported eating the highest amount of good fats, unsaturated vegetable fats, such as those found in avocados, were 25% less likely to develop type 2 diabetes compared with women who ate the least amount. Technically, an avocado is a fruit, but because of its high fat content, 4 grams in 1/4 of a medium-sized avocado, it should be treated like a fat. That same serving of avocado contains a respectable 2 grams of fiber with just 2 carb grams. In addition to guacamole, you can use avocados in salads and sandwiches, or make a salad dressing by pureeing it with a little lemon juice, garlic, and olive oil. If you want to speed up the ripening process, put an underripe avocado in a brown paper bag, close it, and leave it on your kitchen counter for a day or 2. Beans. There may just be something to that old line, beans, the magical fruit. Of course, you probably know that beans are high in fiber and a good source of protein. But now there are even more reasons to include them in a diabetic diet. In a 2012 study, researchers found that eating about a cup of legumes daily resulted in better blood sugar control for both blood glucose and A1C, and lower blood pressure. Further, consuming more fiber may lower the risk of a first-time stroke, according to the American Heart Association, AHA, Journal Stroke. The researchers concluded that every 7-gram increase in total dietary fiber was associated with a 7% lower risk of a first-time stroke. The AHA recommends getting at least 25 grams of dietary fiber daily. A 1/2 cup serving of cooked navy beans has more than 9 grams of fiber and counts as 1 starch and 1 lean meat. Other delicious varieties of beans include black kidney, garbanzo, white lima, and pinto. You can cook dry beans or use canned beans, but remember to look for low-sodium versions. Try using beans as your main protein source a couple of times a week plain, in salads, in soups, or as a substitute for ground beef in Mexican dishes, such as bean tacos or burritos. Beans are good for your wallet, too. They are about the cheapest protein source around. Blueberries. Blueberries are part of the family of fruits containing flavonoids, known for their many health benefits, including heart health. In addition, blueberries' high fiber content may reduce the risk of diabetes and cognitive decline, and help keep blood sugar more level, says Joanne M. Gallivan, M.S. Road, Director of the National Diabetes Education Program at the National Institutes of Health. Recent studies have also shown that berries have an anti-cancer effect by inhibiting tumor growth and decreasing inflammation, Gallivan says. One of the specific types of antioxidants found in blueberries are anthocyanins, which give them their blue color. Recent research links eating foods rich in anthocyanins with a lower risk of type 2 diabetes. The researchers found that people who ate 2 or more servings of blueberries weekly reduced their risk of developing type 2 by 23%, even after adjusting for age, weight, and lifestyle factors. While these results are promising, it should be noted that further studies are needed to determine the causal relationship between eating blueberries and decreased chances of developing diabetes. Broccoli. This non-starchy vegetable makes just about every superfood list, and it's easy to see why. For starters, it has more vitamin C per 100 grams than an orange. Plus it's high in the antioxidant beta-carotene, which the body uses to make vitamin A. This dark green vegetable's vitamin A power promotes healthy vision, teeth, bones, and skin. It is also rich in folate and fiber, all with minimal calories and carbs. Broccoli is a member of the cruciferous vegetable family, which includes other veggies such as Brussels sprouts, cabbage, cauliflower, and bok choy. What makes this class of veggies unique is the high levels of sulfur-containing compounds known as glucosinolates, perhaps better known for their potential anti-cancer effects. These compounds may also have a role in reducing heart disease risk and heart-related deaths. In a study reported in the American Journal of Clinical Nutrition in 2011, researchers found that cruciferous vegetable consumption was associated with a reduced risk of death from heart disease. Their recommendation: increase consumption of vegetables, particularly cruciferous vegetables and fruit, to promote cardiovascular health and overall longevity. 1 serving of broccoli is 1 cup raw or 1/2 cup cooked. You can enjoy it raw with hummus or a low-calorie dressing, or use it chopped in eggs, pizzas, pastas, salads, and stir-fries. The key to great-tasting cooked broccoli: don't overcook it. The stem portion should be barely tender, and the broccoli should be bright green. Carrots. Cooked or raw, carrots are a healthy addition to any meal plan. Well-cooked carrots have the rich texture of starchy vegetables, such as potatoes. They are classified as non-starchy veggies because they don't contain a lot of carbohydrate. A 1-cup serving of raw carrots has about 5 grams of carb, as does a 1/2 cup cooked serving. According to the American Diabetes Association, 5 baby carrots are considered a free food and do not need to be counted in a meal plan. Carrots are noted for their high vitamin, made from the antioxidant beta-carotene in carrots. This vitamin is necessary for good vision and immune function, and it may help prevent the development of some cancers, according to the Mayo Clinic. There are now even more good reasons to eat your carrots, according to a study reported in 2013 from the Stanford University School of Medicine. Beta-carotene may even help lower the risk of developing type 2 diabetes among people who have a genetic predisposition for the disease. Enjoy raw carrots with a low-calorie dip or salad dressing. Shred them for salads, finely chop them and add to soup, chili, or spaghetti sauce, or roast them in the oven. Pureed cooked carrots also make satisfying soups.